Hello, I'm Dr. Radhika, consultant dermatologist, trichologist, and cosmetologist of Aura Cutisrug Clinic, Malleshwaram, Bangalore. So, basically, what is skin allergy? Skin allergy is nothing but also called as urticaria or hives. So, how do the patients comes to us? They come to us with multiple red rashes associated with swelling and itching. They can also have something called as angioedema. That is nothing but swelling of the lips, eyelids, and a difficulty in breathing, or also pain abdomen. So, who all can be affected with urticaria or the skin allergy? Almost everyone can be affected in their life once or twice. So, how do they present to us? As I already told you, they can have redness, swelling, and itching, and along with a difficulty in breathing. So, what can cause skin allergies or the urticaria? Urticaria can be caused due to any food intake that we take. That can be due to the Chinese items or the coloring items or the flavoring items that has been added to the food, or it can be secondary to any kind of infections. Either it can be a urinary tract infection, a gastritis, even though the dental infections that we usually do not care about, that can also cause urticaria. And the other infections that can be caused is your eye infections or throat infections, or what we usually call as the upper respiratory tract infections. Or it can also be caused by few of the drugs, like usually patients when they take all these painkillers, like the headache tablets or a painkiller that is to relieve their bone pains, that can also cause urticaria. So these were the causes of acute urticaria, that is nothing but the skin allergy which lasts less than 6 weeks. So there is another skin allergy which lasts more than 6 weeks, which is called as chronic urticaria. So the causes for these can be any kind of physical, that is even a cold water or a hot water, or even a sun allergy, also called as physical urticaria. That is whenever you kind of scratch, there is a urticarial rash that comes on your skin, called as dermographic urticaria. So these are the other urticarias or the skin allergies that patients usually come to us with. So why does this happen? Why does it happen only to few people and it doesn't happen in everyone? It's mainly because of each and every person's individual genetic makeup. So because of which the individual's immunity kind of overreacts with the triggering antigens. So, what can a person do about it when he has this kind of skin allergy? So, he can use homemade remedies like a little bit of coconut oil or a soothing agent can be added on the skin, which kind of calms his skin down. Or if he is having a lot of rashes, then he has to meet a dermatologist where he will be prescribed few medications like antihistamine, that is your levocetirizine, fexofenadine, bilastine, which are non-sedating antihistamines. If it is very severe, that is what we call it as anaphylaxis or a angioedema, where there is swelling of the eyelids, swelling of the lips, a lot of breathing difficulty or a pain abdomen, or if he is feeling little bit of uneasiness, then he will be put on emergency drugs like intravenous steroids or oral steroids, or sometimes even epinephrine injections has to be given. So, when you have these kind of rashes, when should you meet a dermatologist or when should you get an investigation done? Usually, acute urticaria do not require any kind of investigation. If it is only a chronic urticaria, then a doctor or a dermatologist or an allergic specialist ask for investigations. So, what are the investigations that has to be done? It is usually a thyroid profile. It's usually complete blood count with absolute eosinophil count, ESR, CRP, and it is also anti-TPO antibodies which has to be done.